Young people's access to quality health services in Uganda is not necessarily at par with the young people's health needs, especially towards sexual reproductive health and rights. With this knowledge in mind, Reproductive Health Uganda and its partners came out to address the dire need, especially in the hard-to-reach areas of Uganda.
My name is James Tumsime. I work as the Gender and Youth Coordinator at Reproductive Health Uganda, and I have been coordinating the SRH Alliance projects. We have implemented the Access Services and Knowledge project. We have implemented the United for Healthy Tomorrow project, and we have also implemented the Youth Encourage project. These projects all share a few things in common. Their main objective really is to increase the access to sexual and reproductive health services of young people, to create an enabling environment for young people to access these services, and also to give them adequate information in the form of comprehensive sexuality education so that they can make informed decisions, informed choices to utilize services and protect themselves.
Access Services and Knowledge project was developed to address two key issues of comprehensive sexuality education and service delivery. The project rolled out in 3 districts of Uganda: Iganga, Tororo and Gulu. This was just but one of the 3 other programs which were rolled out with the same approach.
The Sexual and Reproductive Health and Rights Alliance is one of those in 9 countries with funding support from the Netherlands government. There is an Equal Alliance in the Netherlands with several different organizations, and in Uganda, RHU is one of the 12 organizations that form the alliance. We have been implementing projects in the districts of Northern and Eastern Uganda, and in the districts of Gulu for RHU, in Iganga and in Tororo specifically. In these districts, we have used the same model almost all the time. We have integrated sexual and reproductive health information and services. We have worked with young people to provide this information and services.
Through the RHU youth structure, youth were identified and trained as peer educators to help reach out to fellow young people.
We came up with peer educators. These are community people that, with the support of these communities, they were identified. And after identifying them, they had to undergo the training in peer education, basically looking at how they could offer SHR services. So basically, they pick most of SHR commodities, things like condoms, contraceptives, and they go to the community providing education like condom education, as well as providing commodities to these young people.
My name's Jaka David from Mudakori Village, Eastern Division, Tororo Municipality. I'm 25 years old. I'm married, 1 child. I joined peer education in 2013, and really, I personally have benefited from peer education. I've gained knowledge. I've also planned my family.
David, a trained peer educator attached to RHU Tororo. He is married with 1 child. He wakes up every day and cleans up and goes to the garden for 3 hours. He then cleans himself up and picks his bag and goes to check on his clients as well as meet new clients.
Daughter, bye. It also depends on how I've planned. I may say today, as a Wednesday, I would like to meet around 10 clients. Then that one I can say I give them like 2 hours, which means from 9 to 11 something, 11:30 or 11:45, I'll be packing back my things and come and do other work.
In order to increase access, David moves around in people's homes to see his clients and sometimes follow them up to the health centers.
In the process of referring a client, we have a referral card. There is where a person who is referring a client to a health facility has to sign. There's a provision, and after there is where a health worker or a service provider has to sign, and we have to follow up that client up to his or her home to make sure that he or she was received, and we also go to our health centers to check whether that client reached.
The peer educator's role has been well played, creating new challenges. Isaac Oloko is a peer educator trained by RHU and attached to Mulanda Health Center 4. Him being in charge of the Youth Corner, he cites challenges of space.
Currently, the Youth Corner is not functioning because IRS has interfered due to shortage of the rooms that we have at the health unit. We share one room with IRS, and since IRS has kicked off, I had to first quit of which we are going to quit for 25 days from now to 29th this month, and we shall open again after 29th, that is maybe 30th.
The Access Services and Knowledge Project has the young people at the core of its implementation, and the peer educators take center stage.
Peer educators were key in the implementation of the project. Since this was a youth-focused project, so peer educators were very important. The health facilities chose the peer educators to use during the project time, and they gave us 12 peer educators per sub-county.
With this kind of peer structure, the Access Services and Knowledge Project objectives are on course.
ASK project aims at increasing access of quality SHR services, especially targeting young people between the age of 10 to 24. And it looks at ensuring that public health facility and private health centers or clinics provide quality SHR services to the young people.
With over 60 peer educators trained, the project has helped to close the gap in accessing services for young people, especially in HIV counseling and testing, STI management, family planning, as well as in access to information.
We were very, very happy that this project came to this district because of the gap that we had seen in terms of services being offered for young people, especially the adolescents in this district. For a long time, the young people did not have access to quality services. For example, quality reproductive health services, including HIV counseling and testing services, screening for STI and STDs, family planning services, and access to information that can give them skills, life skills, to be able to avoid, for example, unwanted pregnancy. Other methods. We have one.
Dr. Okumu emphasizes the need for the project to cover the uncovered areas in order to share the successes that have been achieved in the 3 sub-counties where the project rolled out.
We have seen that this project has been implemented in 3 sub-counties. 3 sub-counties out of the 21 sub-counties in the district. It's almost a drop in the ocean, but it has got a multiplier effect. The 3 sub-counties, we have been able to train over 60 peer educators who have been able to work along the young people.
In order to ensure sustainability, Reproductive Health Uganda has interested other stakeholders like government, and this has created a confirmation that this model can still be pushed further and guarantee continuity.
I would say that we don't work alone. We are working with so many other stakeholders. We are working with government, of course that includes the Ministry of Health. We are talking about the Ministry of Gender, Labour and Social Development. We are talking about the Ministry of Education. We are talking about the Ministry of Finance and very many others who will join us. Reproductive Health Uganda does not only work at national level, but at district level we are also very active. I would want to say that we have more than 18 clinics countrywide in all regions of the country.
During the exit meeting, Dr. Okumu further talks about the commitments made by the district officials in as far as access of services by young people is concerned. He says time has been allocated for young people at health facilities and adds that this has been done at the Health Center 4 and Health Center 3 hospitals that set aside Fridays from 2 to 5 p.m. and even named Fridays the Youth-Friendly Services Day.
As a district, our commitments were in 3 areas. One, that we would be able to allocate time in our health facilities for young people. And I'm glad that we have done that. All our Health Center 3, Health Center 4 and hospitals now have time allocated for young people from 2 o'clock to 5 o'clock every Friday. We called it the Youth-Friendly Services Day.
As the project exits, it's without say that there has been recognizable benefits.
I want to stress that the ASK project has actually delivered more than our expectations. Over the last few years, we have reached over 900,000, almost 1 million young people with services. Different services, including knowledge. We have increased access to services. We have also impacted on their attitudes.
Of the key intentions of this project, we worked around improving the environment for young people to receive sexual and reproductive health services. And I'm glad to mention that especially the district local governments have taken it upon themselves. They have created specific hours for young people at health facilities to access services. In Tororo, for example, every Friday from 2 p.m. to 5 p.m. have been labeled as youth-friendly service hours, and this has been communicated to all health facilities. So we are now coming up to mobilize young people to inform them about this new development so that they can go to health facilities between 2 to 5 p.m. every Friday and access these services.
I advise others to approach the peer educator to seek advice from him and other small education from him, because we can access him and he's here in the village.
The project has transformed the young people's lives in the areas where it has been implemented. However, the need to further extend the services, access and knowledge to young people in hard-to-reach areas in Uganda is still necessary.